I'd like to talk today a little bit about drains. These are drains that we used in plastic surgery. They are tubes that is attached to a bulb. There are 4 points I would like to discuss. Number one, what is a drain and why is it used? A drain, as I mentioned, is a plastic tube. Is it attached to a bulb which collects all the fluid? The drain is placed underneath the skin and essentially it prevents buildup of fluid underneath the skin and therefore allows the tissues to heal better. So that's the first point. Number two, how is it placed in surgery? So basically, if you look closely at the drain, you see that there are grooves here and the fluid goes into these grooves. There is a black dot here, which we have to make sure stays underneath the skin. And then there's the soft end that ultimately gets attached to the bulb. The way it's placed is we put it underneath the skin. We have to make sure that this black dot stays inside and we suture it in. So the drain is sutured in. And then we take it and we actually stitch it in position. That's how it is placed. So the second point is how it's placed. Number three, how is it removed? Usually it's connected to the tube. Essentially we just open this, cut the stitch, and just pull it out. And the final point is, how does it work? So this is the part that I think is very important for patients undergoing surgery, because it can be very daunting or very scary to have this drain, but in fact it's quite simple to use. So the way we function and the way we use it is, this tube is attached to the bulb, and if you look at the bulb closely, it has measurements here for the number of milliliters, and it has the part where the drain attaches, and then it has this button that closes. Now, when you close it, that's how it is, but usually to be able to suck fluid in, you have to remove the air to create a negative, like a more of a vacuum effect, and that then sucks out the fluid. I'm going to demonstrate this with this bottle of, with this glass. Assume this is blood, it's actually just water with some red food coloring. And I'm going to put this directly inside the bottle. Okay, it has to be submerged, of course. And the other end is attached. Now, if I close this, you will notice nothing happens. But if I close it after I remove the air and let go of the air, you will see that it just sucks all the fluid out. So that's how this works in surgery as well. So any buildup of fluid, once you remove the air, so it's so important to remove the air. I'm going to demonstrate that again. Again, you will notice that there's no fluid coming out, but once I remove the air, it creates the suction, and all of a sudden, the fluid comes out. So this point of removing the air is probably the most important one there is.